Hello, I'm Jenny Rodriguez, the Director of Clinical Education at the University of Colorado Physical Therapy Program. We recently implemented a new curriculum in our DPT program that culminates in a year-long internship in the final year of the program. Our first set of interns will enter this experience in August of 2016. Thank you for taking the time to listen to this brief module designed to provide more details about the internship. This presentation contains an overview of the year-long internship, which includes both a pre-graduation phase, Clinical Education 3, and a post-graduation phase. I will review the goals and expectations, structure, and performance measures for each of these phases of the internship. In addition, I will discuss the roles of the student intern, clinical instructor mentor, and the physical therapy program throughout the internship. Our new clinical education curriculum provides early and frequent opportunities for students to participate in clinical education. This is critical for bridging theory and learning in the classroom with application and real-world practice in the clinical environment. In the first 2 years of the curriculum, students gain breadth of experience through integrated and full-time clinical education experiences. By the time they enter the final internship in the third year of the curriculum, students will have completed 22 weeks of clinical education with a variety of patient types and in different clinical settings. Combined with the year-long internship, students gain both breadth and depth of clinical experience. Students enter the internship at the end of August, graduate in December, and continue at the same site with ongoing mentorship until the following August, at which time the next intern begins. This figure illustrates the timeline for each component of the internship. Clinical Education 3 is the first 4 months of the internship, which occurs prior to graduation. To minimize the gap between graduation and licensure, we encourage students to take the licensure exam in October, prior to graduation, where states will allow. If a student chooses to wait until after graduation to take the exam, some states, including Colorado, allow them to obtain a provisional license until taking the exam in January. In the next series of slides, I will outline the nuts and bolts of each phase of the internship, including the goals and expectations, suggestions for structuring the experience, and the performance measures and benchmarks we will use. Although we have implemented a new curriculum, our overall goal remains the same: to prepare our graduates to be generalist physical therapists, ready to manage a variety of patients across the continuum of care. With the new internship model, we anticipate our graduates will be better equipped to meet the current and future demands of practice within a complex and changing healthcare system. Since students will be graduating at the end of Clinical Education 3, this pre-graduation phase of the internship will focus on meeting entry-level competency on all skills in the CPI. Students will develop their own professional identity and begin to implement their own philosophy of care. We believe continuing in a structured mentor experience in the post-graduation phase of the internship will enable graduates to assume their full professional role and allow for a seamless transition into the profession, from intern to novice or new professional. Therefore, we expect interns to be able to meet beyond entry-level competency as described in the CPI during the post-graduation phase of the. Although there continues to be national dialogue around what entry-level really means, the CPI does provide a definition of what it should look like based on observable behaviors. As this slide indicates, the left column describes entry-level performance, which is more than being capable of carrying a full caseload. Students or interns demonstrating entry-level competency are proficient in managing patients, whether they have more simple or complex problems, without needing guidance or supervision. They are willing to consult with others when faced with unfamiliar or challenging situations. We do expect students to demonstrate this level of performance by the end of CE3, the pre-graduation phase of the internship. Please note, this is no different than our current expectations of students in CE3 and 4 who graduated prior to implementing the new curriculum. During the post-graduation phase of the internship, with structured mentoring and opportunities for professional development activities, we expect interns to be able to demonstrate beyond entry-level performance. In contrast to entry-level performance, the column on the right highlights characteristics of beyond entry-level, which take into account the ability to handle increased complexity of patients and environments, along with expanded professional roles and responsibilities. Until we have a full complement of internship sites, some students will finish the program with Clinical Education 3, the pre-graduation phase of the internship. Regardless of whether a student participates in a year-long internship or 16-week experience, our goal is for all students to have a high-quality final clinical education experience. One characteristic that may contribute is having an intentional curriculum or structure for the experience. This slide provides suggestions on how to structure the pre-graduation and post-graduation components of the internship to maximize the intern's learning and professional growth. Focus in the pre-graduation phase, CE3, will be on patient care activities, allowing the student to gain independence with an increased caseload as time progresses. Having time for reflection and time with the clinical instructor for feedback, discussion, and goal setting will be critical in challenging the student to grow and learn throughout the experience. Students also complete 2 assignments in the pre-graduation phase. The purpose of these assignments is to encourage the intern to reflect on their experience and on being an integral part of the clinic. Once a student has demonstrated that he or she is capable of managing a full caseload, learning should continue based on set collaborative goals addressing all domains of learning: cognitive or critical thinking and clinical decision making, the psychomotor or hands-on skills, guarding, facilitating movement, and the affective domain, which is professional behaviors and communication and values. In the post-graduation phase, each site will determine expectations around the balance between direct patient care responsibilities and time for additional learning opportunities. The intern's salary should allot time with a mentor and for professional development activities. Results from the internship pilot we conducted with the University of Colorado Hospital suggest carving out approximately 4 hours per week for non-direct patient care activities. Interns who participated in the pilot shared that time spent with their mentors was the most valuable aspect of the experience. During the pre-graduation phase of the internship, CE3, we will continue to use the CPI and monthly benchmarks to evaluate the student's performance. These tools provide a great framework for making sure the student is on track to meet entry-level competency by the end, as well as adding structure to the experience. In the post-graduation phase, interns will create a professional development plan that guides learning activities and self-evaluation. The intern will set goals in each of the areas included in their professional development plan. At regular intervals during the post-graduation phase, the intern, in consult with their mentor, will assess progress towards meeting these goals. The intern will continue to revise the professional development plan throughout the remainder of the experience. Though we expect interns to demonstrate beyond entry-level performance on the CPI during the post-graduation phase, we will not use the CPI to formally evaluate the intern's performance. Instead, interns will be evaluated using the site's established employee performance. The role of the student and CI are well understood during the pre-graduation phase of the internship. However, role delineation is different once the student has graduated from the program. Following graduation and once licensed, the intern functions as a new clinician. He or she no longer requires supervision and can now bill fully for services when working with patients. The intern is now expected to drive the learning experience, and the mentor's role is to guide and facilitate the intern's growth and development, not to monitor or supervise individual patient encounters. The relationship between student and CI shifts from instructor-student to a mentor-mentee collaboration. To assist with this transition, you may consider having a different person as the intern's mentor in the post-graduation phase of the internship. The role of the academic program also changes once the intern graduates. The academic program no longer has legal authority over the intern or the experience, but is available to provide support and resources as needed. The goal is to have an effective partnership where all parties, interns, mentors, and academic program, work together during the pre- and the post-graduation phase of the internship to ensure the best quality clinical education experience. If you have questions about any aspect of the internship, including the pre-graduation and post-graduation components, ideas for structuring the experience, or assistance with the mentoring process, please contact either myself or Katie Myers, the Assistant Director of Clinical Education. For additional clinical education resources, we encourage you to access the Clinical Instructors Community, our free website for clinical instructors. On behalf of the entire clinical education team at CU Physical Therapy, thank you for your continued support and commitment to providing excellent clinical education to our DPT students. We appreciate your willingness to participate in this new internship model.